Hello, my name is Dr. Charles Weaver. I am a medical oncologist and the founder and publisher of Cancer Connect. I want to thank you for joining us today for a live web chat with Dr. Lee Jones and Cara Anselmo from Memorial Sloan Kettering Cancer Center on lifestyle and cancer, answering your questions about diet and exercise. Dr. Jones is an exercise scientist at Memorial Sloan Kettering Cancer Center and will discuss the benefits of exercise, including how staying active can help you fare better during cancer treatment and recovery. He will also talk about his related research on the efficacy and mechanisms of exercise training on cardiovascular side effects and tumor growth. Ms. Anselmo is a registered dietitian and nutritionist at Memorial Sloan Kettering Cancer Center. She will discuss the role of nutrition during and after cancer treatment, as well as obesity and cancer risk. During today's program, you'll have the opportunity to submit questions. Just type in your question in the space provided below on this screen. Our experts will answer as many questions as possible in the time allotted following their presentation. I will now turn the presentation over to Dr. Jones and Ms. Anselmo.
Good evening, everyone. Thanks for being here. I'm Cara Anselmo. I'm a registered dietitian nutritionist at the Memorial Sloan Kettering Outpatient Breast Center. So we'll start by asking the question, why does nutrition matter? And while a given diet can't prevent or cure cancer, good nutrition can reduce disease risk, as well as improve quality of life, immune function, healing, and even survival. So that's good news. So practically speaking, this begs the question, what is good nutrition? What should I eat, and what should we be consuming for the most benefit? And I'm not going to present a list of good and bad foods or do's and don'ts. That's because the right diet for anyone, but particularly in the setting of cancer, is different from one individual to the next. There's no cookie cutters. It's important to think about what your nutrition goals are, both immediate and long-term, and consider big picture best practices. So keeping in mind the importance of individual variability and needs, for most people, an ideal diet has some common characteristics. It's mostly plant-based with the right amount of calories to maintain a healthy weight and lean body mass. It includes a variety of whole vegetables and fruits, and minimal added sugars. The American Cancer Society suggests limiting alcohol intake and minimizing red and processed meats. An ideal diet is sustainable, flexible, and long-term. It's a lifestyle. Following a balanced diet isn't the same as, quote, going on a diet. Of course, there's always exceptions. Cancer symptoms and treatment side effects may mean you have to adjust your diet. If you're experiencing acute diarrhea, for example, you would want to reduce fiber-rich vegetables and whole grains and maybe choose white rice and plain toast instead. The symptoms and side effects listed here on this slide are some common ones during and after cancer treatment. You always can ask to speak with a registered dietitian or nutritionist to talk about managing specific concerns. For instance, if you have changes in taste that make it hard to drink plain water, which is important, you might want to try flavored seltzer or try adding sliced cucumbers or lemons to your water. If you feel nauseated, it might be best to avoid hot foods and foods that have strong odors, and instead choose cool, bland foods, as well as try ginger tea. Remember, do your best at any given point to eat healthfully without making yourself miserable or worrying that your food choices are hurting you. If you haven't had an appetite for days and you lost too much weight, and then one day you have a taste for chocolate chip cookies, let yourself have some and enjoy them. So unplanned weight loss and weight gain may occur during and after cancer treatment. These changes can be related to the disease itself, behavioral changes, medications, and other factors. Some types of cancer are more associated with weight gain and some with weight loss. For example, about half of women who receive adjuvant treatment for breast cancer gain weight, whereas women and men treated for head and neck cancers usually lose weight. Either losing or gaining too much weight can be a problem. In the setting of breast cancer, for example, undesired weight gain may increase recurrence risk, other disease risk, and risk for death. On the flip side, excess unintentional weight loss and underweight are associated with poorer outcomes. Excess or insufficient body weight can also compromise healing, immune function, and quality of life, including your mood, social well-being, and energy level. So if you gained excess weight during treatment, be assured that while losing weight is never easy, it is still possible. One of the best places to start is keeping a written food diary. This immediately increases your accountability and makes you more aware of your food choices. Portion control is also very important. I find many people aren't eating foods that are unhealthy per se, they're just eating too much of them. Go slowly and eat mindfully. Your brain needs at least 20 minutes to recognize that your stomach is full. If you rush through a meal, you'll often end up overeating. Learn to read your body's natural appetite and satiety cues. If you tend to eat when you're not physically hungry, and we all do that sometimes, check in with what you really want and what you really need. If you're tired or stressed, for example, you would probably feel better just sitting down with a favorite book or calling a friend or going for a walk rather than eating. But always have something you're looking forward to more than just your next meal or snack. On the other hand, if you've lost weight without wanting to, do be patient with yourself. Sometimes it's best to set an immediate goal of maintaining the weight you're at rather than putting pressure on yourself to regain. Increase your intake gradually, eating frequently in small amounts that don't feel overwhelming. Homemade shakes and smoothies can add calories without making you feel overfull. You might want to try a smoothie, for example, made with almond milk, cocoa, a banana, and honey. Commercial supplement drinks are also available. Try to choose foods that'll give you some pleasure, and incorporate foods that are high in calories. Don't be afraid to have full-fat rather than low-fat versions of foods. Eat nuts, nut butters, extra olive oil, breads. So switching gears a bit, I'd like to address obesity and cancer risk, because more and more evidence is showing that obesity is associated with new cancer development, whether you've had a history of the disease or not. In fact, obesity might soon surpass tobacco use as the #1 preventable cause of cancer in the United States. We're still exploring why this is, but we know that excess fat tissue is associated with increased levels of growth-stimulating hormones, chronic inflammation, and other biologic contributors to tumor development. Body mass index, or BMI, is an objective measure most commonly used to define overweight and obesity. BMI is a measure of your weight based on your height, calculated by dividing weight in kilograms by height in meters squared. And here's a BMI chart where the math is already all done, showing weight in pounds at the top, height in feet and inches on the side, and you can go towards the middle of the chart to find your BMI. When using BMI as a reference, an ideal range is defined as 18.5 to 24. Overweight is 25 to 29, and obesity is a BMI of 30 or more. When we talk about diet and cancer risk reduction, a common belief is that sugar causes or feeds cancer. In reality, it's more complex than this. There's not a one-to-one relationship between eating foods with sugar and tumor growth. However, diets high in added sugars contribute to overweight, obesity, and therefore, as we just saw, a metabolic environment that favors cancer development. Eating or drinking too much of anything, though, whether it's bread, soda, or meat, can cause weight gain. The World Health Organization and American Heart Association suggest limiting added sugars to no more than 24 to 36 grams per day. Keep in mind, this isn't just the sugar that you add to your coffee or tea. So many foods are loaded with added sugars. A 6-ounce cup of fruit-flavored yogurt, for example, might have more than 30 grams of sugar, and a bowl of Frosted Flakes has 25 grams of sugar. I want to take a moment to address the use of oral vitamin, mineral, herbal, and other dietary supplements because it's so prevalent. 50% of adults in the United States take supplements, and 64 to 81% of adults who've had a cancer diagnosis take them. Because dietary supplements are unregulated before sale in the United States, they're a gamble. Unlike with food or drugs, we have no way of knowing that what's written on the label is what's actually in the product. Risks include contamination of products as well as interactions with other nutrients, herbs, or medications. Keep in mind, just because a product is natural doesn't mean it's safe. Furthermore, research actually shows worse disease outcomes with the use of certain dietary supplements. Excess folic acid, vitamin E, and selenium in supplement form have all been associated with worse prognoses in adults with certain types of cancer. In some cases, as with fiber, omega-3 fats, and soy isoflavones, we see benefits with incorporating whole foods with these compounds, but not a benefit with taking supplements, and sometimes even harm with concentrated or extracted dietary supplement forms. MSK's About Herbs website is an excellent resource for learning more about vitamin, mineral, botanical, and other dietary supplements. There's also a free app shown here, which you can download to your smartphone. So survivorship is defined in many different ways, but whether you've finished treatment entirely or you'll be receiving long-term therapy, nutrition matters as you move forward. Don't lose sight of the big picture. We often hear about cancer-fighting foods, but I'd rather talk about balanced and healthful foods and a cancer risk-reducing lifestyle, one that includes a variety of whole plant foods, exercise, no tobacco use, and promotes a healthy body weight. If you'd like to speak with a registered dietitian nutritionist at MSK, you can call the numbers shown here to schedule a consult. Thanks very much.
Well, good evening, everyone. It's a pleasure to be here. My name is Dr. Lee Jones. I'm an exercise scientist here at Memorial Sloan Kettering Cancer Center. My role as a principal investigator here at Memorial Sloan Kettering is to study the effects and mechanisms of exercise in individuals who have been diagnosed with cancer. So over the next 10 minutes or so, I'll just give you a brief overview of some of the research that we've done in the past, as well as some of the research projects we have on the go here at Memorial Sloan Kettering. I think the first important question is, why are we even thinking about the role of exercise following a cancer diagnosis in the first place? As many of you will know, we've had significant improvements in survival in individuals who have been diagnosed with cancer over the past 40 years or so. And this is depicted here in this top figure. So this figure here shows the 5-year relative survival rate, or the number of individuals living 5 years and beyond following a cancer diagnosis. And you can see in 1975, the 5-year relative survival rates for all cancers combined was around about 50%. But now, through advances in screening and treatment following a diagnosis of cancer, we are delighted that this survival rate is now up to around about 67%. So we've just made significant inroads into survival following a cancer diagnosis, which is obviously truly fantastic. And if you actually look since the early 1990s, the nation's cancer death rate has dropped 18% in just a short period of time. And as a result of this, there's over now 14 million survivors of cancer just in the US alone, which is truly fantastic. And this is estimated to be about 30 million worldwide. And I think importantly, this is up from just 3 million back in the early 1970s. And this number is going to just continue to increase. We know that there's an increase in the number of individuals who have been diagnosed with cancer. We've got a rapidly aging population. So this number is just going to continue to increase over the next 2 decades. And of course, this is something to be celebrated. But something important that comes along with this is what we're starting to understand is in individuals who are living longer and longer following a cancer diagnosis, we're starting to see some of the ugly side effects of the treatment. So some treatments that you might have gone through are very effective at killing and controlling tumor cells, but sometimes they also can cause damage to the other normal organs within the body. And so what we're starting to see is some of these late effects that are associated with therapy. And in our research program, we've been very interested in trying to characterize and understand what these treatments are doing in terms of the effects on the whole body. So what we've coined this phrase is something we call the multiple hit hypothesis. Essentially, as you go through cancer therapy, the body might experience a series of hits depending on the type and nature of cancer therapy that you receive. So we obviously know that the vast majority of individuals diagnosed with cancer are already over the age of 65 to begin with. So many individuals might already present with cancer and might have some risk factors for the development of things like cardiovascular disease. They may be obese, they might have diabetes, they might have a former heart attack. So we know it's already, if individuals coming in at diagnosis, already might be at a slightly higher risk. And of course, what happens then is there's an impact of the therapy that you'll receive for your treatment of cancer. And whether that's a combination of surgery with chemotherapy or radiotherapy or hormone therapy, we know that these different types of therapies can cause a series of different degrees of maybe injury and damage to the different organ components of the cardiovascular system. So we know that there's certain treatments can cause damage to the lungs, they can cause damage to the heart, maybe even damage to the blood vessels, and also maybe damage to the muscle. We know that many different types of therapies can cause your muscles to shrink away, and that's something called muscle atrophy. And that can impact the functionality of this entire system. And then finally, as individuals go through cancer and cancer treatment, they can become more inactive. And so there's a kind of a global deconditioning effect, and also can gain weight at the same time. So there's many things that can happen and many hits that the system might receive as you go through cancer therapy. So we've been interested in trying to measure the impact of cancer therapy across this entire system. And the way that we can do that in something what we call this a decrease in your cardiovascular reserve capacity, essentially something like your fitness level. And so we've been very interested in measuring fitness levels in individuals who have been diagnosed with cancer and going through various types of cancer treatments. So the way that we measure this in our laboratory is we do a test, something called a cardiopulmonary exercise test. So this is like, if anybody's done a stress test before, this is like a fancy stress test. Essentially, this is one of our lung cancer survivors here. Essentially what we can do these tests on a treadmill, or we can do it on a bike, as seen here. And essentially, we make somebody exercise at a very low intensity. Then every minute, we increase the intensity of the exercise, as if they're pedaling up a steeper and steeper hill, or walking up a steeper and steeper hill, till they get to the point on the hill where you simply can't exercise anymore, and you're just exhausted. So we'll exercise somebody pretty hard. That normally takes about 10 to 15 minutes. But at the same time, just to make it even more pleasant, we have a little tube in the patient's mouth. And what we're doing, we're collecting gas exchange information. We're collecting how much oxygen this person breathes in as they're performing exercise. And we can analyze how much oxygen this person is consuming, and that then gives us the gold standard assessment of somebody's fitness level. And so just to make you put this in context a little bit, when we're measuring that oxygen consumption, that's called the VO2 peak, the volume of oxygen consumed by a person during exercise. In human beings, somebody's VO2 peak, or the volume of oxygen they consume during exercise, can range from somewhere like 10, and this might be an individual with heart failure, all the way up to kind of the Olympic athletes that would literally have a VO2 peak of 80, 85, literally be off the chart. So we know your fitness is really determined by two important things. One is your genetics, which you can't do anything about. The second thing is your level of exercise behavior, which obviously you can do a lot about. So in this figure really depicts how your fitness changes as you get older. And what you can see, hopefully, in all these lines represent different levels of physical activity or exercise behavior. But as you get older, your fitness declines. And it declines about 10% every decade if you hold your exercise behavior constant. But what you'll see is that rate of decline and your level of fitness across the entire age continuum is different as a function of your level of exercise behavior. So what do I mean by this? So if you look at the black line here, this is individuals who are endurance-trained athletes. They're the highest fitness level across the entire age continuum. The line in between, this dotted line, represents individuals who are active, and this bottom line represents the majority of North America, which is the individuals who are completely inactive, the sedentary couch potatoes. So we've been very interested in what happens to fitness if you're diagnosed with cancer. So here we have that same graph that depicts the normal age-related decline in somebody's fitness level. But of course, in somebody who's been diagnosed with cancer, there's then an intervening event in terms of what type of treatment the individuals might receive. So we believe at that point, there's going to be, if you will, an acceleration of the decline in somebody's fitness level as they go through cancer treatment. And of course, this depends on the nature and the type of cancer treatment, but we think this is fundamental decline. And I think very often after we've completed therapy, I think the notion is that your fitness is going to get back to where it was before you had your cancer diagnosis. But is this true? Does your fitness just spontaneously recover, or doesn't it? So you can imagine we can have a number of different scenarios where fitness could just get better after you've finished cancer therapy. It could just flatline, or it could not recover at all and just continues now on the normal age-related decline. But if it is at this normal age-related decline, then you might hit a lot of these important milestones a lot earlier than you would have done if you'd not had a history of cancer and cancer therapy. So over the past few years as a research program, we've been interested in really trying to find out what happens to somebody's fitness level as they go through cancer therapy. So our first question is, what happens during therapy? Do you see this decline or not? So here's some data that depicts the change in somebody's fitness level as they go through different types of cancer therapy. Now, the bar on the far left here represents the normal age-related decline in somebody's fitness level. So that's that 10% decline that we typically see every decade, or 1% per year. And it turns out that 12 weeks of just conventional chemotherapy for early-stage breast cancer patients is also associated with a 10% decline in somebody's fitness. And in other words, we essentially see the same amount or degree of decline in fitness in 3 months of chemotherapy as we do in typically 10 years of normal aging. We also see a similar decline in fitness in individuals, and this is men with prostate cancer undergoing hormone therapy or androgen deprivation therapy. And if you go through lung cancer surgery, there's significant declines in somebody's fitness level. And we're starting to see this across a number of different cancer scenarios. So there really is a dramatic hit to the system or cardiovascular reserve capacity, again, depending on the type and nature of the cancer treatment. So the next question was, does this recover? And unfortunately, we don't have too much data in this regard, but we have been able to publish at least one study in this regard. So this was a very simple study that we published a couple of years ago. Very simple. We brought into our laboratory 140 women who'd completed treatment for their early stage breast cancer at least 3 years prior to them bringing into the laboratory. So essentially, we thought 3 years should be enough for these women to recover from their treatment. So what we see here, the blue bar represents our breast cancer survivors. The gray bar represents women of the same age who have not had a history of breast cancer and breast cancer therapy, who are completely sedentary. And hopefully what you can see here is these women are about 30% below women of the same age who've not had a history of breast cancer and breast cancer therapy. To look at this data in a slightly different way, the yellow line here represents the normal age-related decline in somebody's fitness level. Each individual blue dot represents an individual patient's fitness level. We have a handful of patients who are above the line, but you can see the vast majority are well below the line. And then finally, we are interested in somebody's average fitness level per decade of life. If you take a woman with early stage breast cancer who was age 50, on average, their fitness level will be 19.5. The same fitness level in a woman who's not had a history of breast cancer and breast cancer therapy occurs on average at age 70. So from a physiologic perspective, some of our breast cancer survivors are operating 20 years older than they should be. And we often hear this in clinic, that individuals will say to you, I feel like I've aged as I've gone through therapy. And now we've got physiologic data suggesting that's actually the case. So that's, to date, is the depressing news. The real kicker is can we do something about that? Can we prevent that hit happening in the first place? And of those who have completed therapy, can we help people recover? So what we've been doing in our program is looking at the role of exercise to do this. Now, we believe that the nature of the impairment is multifactorial. It impacts a lot of different organ systems within the body. So therefore, you also need an intervention that can improve the reserve capacity of all these different organ systems at the same time. And I'm afraid there just aren't drugs that can do that. The only drug that we have that can do that is exercise. So exercise, as many of you will know, will improve your cardiac function. It will improve your arterial system and your blood vessels, and it'll also improve the efficiency of your muscle. So the entire cardiovascular system becomes a lot more efficient as you start to exercise. And then this leads to improvements in your exercise capacity. We also leads to improvements in patient-reported quality of life and reductions in fatigue. So we've been very interested in our program in looking at various opportunities, I would say, across the cancer continuum, where we can look at the role and efficacy of exercise to prevent some of these harmful effects of treatment. So you can think about exercise maybe in the prevention of certain forms of cancer in individuals that are at high risk. Following the diagnosis, we've also looked at the role of exercise before even treatment has started. So can we improve somebody's fitness level before they start treatment to then help them not only get through that treatment, but also to recover from that treatment after they've finished? So we can think about exercise in the window between diagnosis and, say, something like surgery. Following the completion of surgery, we've also looked at the role of exercise during cancer therapy. So this could be during chemotherapy or radiotherapy or hormonal therapy. And we've shown that exercise is both tolerable and safe during cancer therapy. Following the completion of therapy, we've also looked at the role of exercise following the completion of therapy. And then we've just also started our first studies looking at the role of exercise in individuals who might have advanced cancer. So there's many opportunities across the entire cancer continuum where we can look at the role of exercise. So just over the next couple of slides, I'm just going to give you a couple of examples of some of the work that we've done in this area. So this is one of the first studies that we performed, and this is an example of an exercise training study that we did in women with early-stage breast cancer during chemotherapy. So if we first look at the figure on the left, this is somebody's fitness levels. The gray bar represents what the fitness level was at baseline, so before they started chemotherapy. The blue bar represents what it was at the end of chemotherapy. On the left, we have the usual care group, or the group that got chemotherapy only. And on the right, we've got the group that got chemotherapy plus exercise training. And hopefully what you can see from this is in the usual care group, or the group that got chemotherapy only, there was a significant decline in somebody's fitness level over the course of chemotherapy. And this was just a 12-week dose of chemotherapy. However, in the group that got exercise training during chemotherapy, you can see not only did exercise completely prevent the decline that we saw in the usual care group, but we actually saw a really nice improvement in fitness of individuals undergoing chemotherapy. On the right here, this is patient-reported quality of life. So essentially how people are reporting how they feel. And what you can see here in the usual care group or the chemotherapy alone group, really no change in somebody's quality of life, but a really nice improvement in somebody who was exercising. So now we have data showing that it can improve fitness, but also improvements in the way that patients report how they feel. In an example study following the completion of therapy, the first study to the left, this is, again, it was a study in early-stage breast cancer patients who've completed their cancer treatment. So this was in survivors. We have the gray bars here that represent the control group, and the blue bar represents those individuals who are randomized to the exercise training group. This is their fitness level, and what you can see is really no change in the control group, and you wouldn't expect it to be a change. These individuals were not undergoing any therapy, but a nice improvement in fitness levels in the exercise training group. The graph to the right here represents a different study. This is a study in individuals with early-stage lung cancer, so this is not just about breast cancer studies. And what we find is, and this was just a single-arm design, so every patient acted as their own control. There wasn't a control group in this study. What we find, so this is the baseline fitness level of these individuals, and at 14 weeks, we have what the improvement was with exercise training. And we saw, over just 14 weeks of exercise training, a 10% improvement in somebody's fitness level. So we're now showing that not only can we do these kind of interventions in women with breast cancer, but also in other populations, such as individuals with non-small cell lung cancer. So just for the final couple of slides here, really what I've focused on to date is the role of our exercise program, if you will, here at MSK, on seeing if we can control some of the cardiovascular and symptoms and side effects of cancer therapy. But we're also interested in, is exercise actually a treatment for cancer itself? So if you are exercising somebody and they report that they feel better following an exercise training program, I think a question that everyone would ask is, what's happening to my cancer? Is my cancer now being inhibited because I'm exercising? What is happening? So we're also doing a lot of work in this domain as well. And just give you really a sense of some of the work that's out there and some of the things that we're doing. So really the data in this area started with this study that wasn't published by me. It was published by Dr. Michelle Holmes, who was at Harvard, back in 2005. So this was almost a decade ago, but it was the first study to look at the relationship between exercise levels and survival. So what Michelle did, she asked 3,000 women who were in the Nurses' Health Study who had a diagnosis of breast cancer. She essentially asked these women how much exercise they were doing and then followed these women for long-term outcomes. She split up the report of exercise behavior in several different categories, going from the blue bar here on this figure that shows that women reporting less than 3 meta-hours of exercise per week, which is essentially less than about 30 minutes of exercise per week, and she regarded these individuals as sedentary, and she compared the survival of those women who are sedentary relative to those women who are reporting higher levels of exercise behavior. And hopefully what you can see here is in individuals whom women reporting 9 to 14 0.9 of exercise met hours per week, which is about 150 minutes of moderate intensity exercise, these women had a 50% reduction in the risk of dying from breast cancer relative or compared to those women who are completely inactive. And this is after controlling for things like their body weight, their age, the type of therapy they received. So this is the individual relationship of exercise. And I can tell you, since the publication of the studies, there have been many other studies that have now found similar relationships between self-reported exercise behavior and improvements in survival, not just following breast cancer, but also colorectal cancer and also prostate cancer. So we're now taking this data and we're using this to inform our preclinical studies or our studies in mice, because I think the question is how much exercise do you need to do to get this response? And what are the mechanisms? How is exercise then impacting something like tumor biology? So that's something that we're very much concentrated here on at MSK. So lots more to come in that role. So just to summarize the past few minutes or so, I think we're showing that cancer therapy is associated with toxicity or impairments in the cardiovascular system. And we think this might be a model of accelerated aging. But importantly, we've shown now that exercise can completely prevent these effects from happening in the first place. And those individuals who completed therapy, we've shown that we also can recover those individuals as well. We've got emerging data suggesting that exercise might improve survival outcomes in individuals who have been diagnosed with early stage cancer. But we don't know why exercise might be working, and we certainly don't know what the optimal amount of exercise is to confer these benefits. So I think really this research program is, I think, at the tip of the iceberg, and our goal of our research program is to make exercise part of standard of care for individuals diagnosed with cancer. That's certainly not the case right now, but the role of our research program is to make that the case. So thank you for your attention. I'm happy to take any questions.
Thank you again for listening, everyone. We hope that you found the presentations helpful, and we will be taking some questions now that have been submitted. So we'll start with one from someone who wanted to know about what to eat during chemotherapy or what not to eat during chemotherapy. And that's a big question, and much depends on the specific type of chemotherapy and on the individual and how they're feeling from day to day. But some important things to keep in mind are, for most people, it's very important to be well hydrated, so drinking plenty of water is important. Food safety is a concern since you might be a little bit immunocompromised during chemotherapy. So I would avoid foods like sushi or undercooked meat, undercooked eggs, some unpasteurized cheeses. And it's also important to avoid most dietary supplements, or just check with your physician or your nurse or your dietitian before you take anything, because there are a lot of interactions with chemotherapy drugs and certain herbal, vitamin, and mineral dietary supplements. Do you want to take the next one?
Yeah, absolutely. So thank you for that. Hello, everyone. So I've got a question here, which is one of the most common questions that I receive when I give talks. Is what's the best type of exercise that I should be doing? What's the optimal type of exercise I should be doing? And so the question is there a priority really between doing resistance type exercise, so weight training, versus doing more cardio-based exercise, aerobic training, which will be walking, swimming, biking, etc. And the question, and really the answer to that is, there's no real type of exercise that's better than one versus the other. It really depends on why you're exercising, what the purpose is that for. So for example, if you're going through, say, hormone therapy for prostate cancer, and we know that type of therapy is associated with your muscles shrinking away, then something like resistance training, of course, will be extremely important to try and maintain muscle mass and lean mass. If on the other hand, it's more interested in just kind of general overall health, then probably aerobic-based exercise is probably the way to go. And depending on if you really push for time in one or the other, in the area of exercise and cancer research, the majority of research has been with aerobic type exercise. So walking is classically the easiest type of exercise to do and can be extremely beneficial for all cancer survivors across the entire continuum.
Okay. So the next question is one about is it healthy to eat a vegetarian diet for cancer patients? And yes, I don't like to use the word vegetarian necessarily, but I do like to say plant-based, with the idea that most of the foods you're eating are from plant sources. And this is something that I do recommend for most of my patients. It's important to include a variety of whole plant foods. So rather than just get stuck on one superfood or vegetable, to really incorporate different ones, whole grains, vegetables, fruits, and to maintain a healthy weight throughout the process. So again, a vegetarian or plant-based diet that includes excess amounts of certain foods is certainly not a good idea either, but moderation with all types of foods is important. And I'll turn it back to you again.
Thank you. So related to the first question that we received about what's really the optimal type of exercise that you should be doing, another question, of course, that always comes up is how much exercise should I be doing? How many times per week should I be exercising? So if you look at the national guidelines that exist for cancer survivors, the recommendations are that individuals should exercise at least 5 days per week. And so, so that's what the guidelines are. But you can imagine for somebody who's not exercising at all right now, going from 0 to 5 could be seen as being quite intimidating and a significant challenge. So I think for me, it really depends on where you're at right now. So if you aren't exercising at all right now, I would suggest that you start exercising maybe 2 to 3 days a week. And maybe, if you look at a typical week, maybe exercising on a Monday, Wednesday, and Friday, or a Monday, Wednesday, and Saturday. Weekends are always good because you have a little bit more time and not pressed by work and other responsibilities. So really just getting, because we think about starting exercise as being a very, very progressive in nature. So starting slow and then building. So if you're not doing anything right now, I would say 2 to 3 days a week. If you're already exercising that 3 days a week, I would say that try and increase that to 5 days a week. And then if you're already exercising 5 days a week, then I don't think there's any real need to go to 7 days a week. Typically, individuals, you need at least 1 or 2 days off a week. Rest is extremely important when you're exercising a lot. So, I think the 5 days a week is really what the recommendation is, and that's really what we should be striving to achieve. But again, it really depends on where you're at right now.
Okay. So switching gears a little bit, there was a question about suggestions for someone who has just finished chemotherapy and radiation therapy for throat cancer, and swallowing and tasting foods has become a challenge. And this is a very, very difficult issue. One of the things that I do suggest is choosing small amounts of food and liquids at a time. Choose small, frequent meals so that you don't feel overwhelmed with sitting down and having a big plate in front of you at once. It's also a nice idea to jot down what you're eating and do some sort of food diary just to keep yourself accountable and make sure that you haven't gone 5 hours without having at least a little something. Eat what tastes good at this point, and if taste isn't that great at all, eat things that don't taste unpalatable, even if they don't taste really great to you right now. This is also where drinks that have high calories and high protein can be helpful, whether that's just having a glass of chocolate rice milk instead of only water to get in some calories, or it might be doing a nutritional supplement drink, and there are commercial ones. You can certainly make them at home with a little protein powder and some frozen fruit. The commercial ones include ones like Orgain. There's also clear liquid ones like Ensure Clear and Boost Breeze, and many people find that these are easier to swallow since they're a little thinner. So when swallowing is a difficulty, definitely liquid calories and protein are a good way to go. Of course, modifying the consistency of foods, pureeing things, putting something in a blender. There's no reason you can't puree any vegetable or fruit, for example, can be nice as well.
Great. Some great suggestions there. So we're now moving really from some practical questions in terms of what's the optimal amount of exercise I should be doing, what type of exercise, to really get into some of the biology, some of the nitty-gritty of how exercise might be working for those of you who have been diagnosed with cancer and have started to exercise. So the question that we have here is what about the effect of exercise on things like circulating tumor cells? So as you know that certain cancers can release cancer cells into the circulation, to the bloodstream. And I think when we first got involved in this area, one of the key questions that we were interested in was if exercise is affecting, as I talked about in my talk about exercise increasing blood flow into tumors, then one of the concerns from that was, does that then increase the number of circulating tumor cells? So what we do know from our mouse models, and certainly from some epidemiologic-based research, that's out there that it appears that exercise is actually associated with decreased risk of cancer recurring, and actually is associated with inhibition of tumor growth in animal models, so the precise question of whether exercise impacts circulating tumor cells, nobody's actually looked at that question. There's no data right now that's available that's looked at that specific question. I can say, though, we are doing a study here at Memorial Sloan Kettering that's actually looking at this question. So we are collecting that data, and this is in the context of a trial we have in women with metastatic breast cancer. So we don't have the results yet, but hopefully we'll have the results soon. Something we're also very interested in is circulating tumor DNA, which is one of these latest biomarkers. So if you can imagine, if we can find out what exercise is doing to this circulating markers of either circulating tumor cells or circulating tumor DNA, then we can take a very simple blood test to see how exercise might be impacting things like tumor progression and progression of disease, and even response to therapy, other therapies. So that's a very exciting advance and something that we're working on here at Memorial Sloan Kettering. So we don't have the data yet, but we'll have it in a few years.
You'll keep us posted.
Keep you posted.
Okay.
We'll keep you posted.
The next question, and there were many questions about dietary supplements, different herbals, botanicals, vitamin and mineral dietary supplements. So I will not have the time to address each one individually. First, I'd like to refer everyone back to the MSK website, the About Herbs website, and I showed a slide that featured that. And again, that's a free app that you can purchase. And that really goes through almost any vitamin, mineral, or herbal that you can think of, and really goes through the research, potential contraindications, reasons for using or not using, safety and efficacy concerns as much as we know. I would also highly encourage a consult with a dietitian who specializes in integrative medicine, and you can go back and look at the phone number for our integrative medicine nutritionist here at MSK. In many cases, there's not much evidence to suggest using dietary supplements, using extracts, using concentrated forms of certain compounds, whereas having the actual foods we do see is beneficial. And just an example of that is curcumin, which is one of the things we had lots of questions about, which is the active component in the spice turmeric. And there's limited research. It's very, very promising research, but at this point, given the fact that it does interact with certain chemotherapy medications and that individual tolerance varies, not to mention product standards, I would encourage using the spice, using it in your cooking, maybe making some tea with it, rather than taking it as a dietary supplement. Again, unless you've checked with your physician, checked with your integrative medicine dietitian or provider, but always ask those specific questions to the appropriate individual, because the answer varies a lot from person to person and supplement to supplement.
Great. So now a question that again, another question that comes up a lot actually, and I think it's a very important one. So this is really looking at the interaction between exercise and immune function. So one of the common questions that we get quite a lot is, if I've been diagnosed with cancer and I'm going through cancer treatment, or even following the completion of cancer treatment, how does exercise affect my immune function? If I'm in an immune compromised state, does exercise then detrimentally impact that? And again, this is a question that comes up all the time. So on the whole, so if you look outside, look at the evidence outside of oncology just for a moment, we know that exercise is one of the most powerful interventions to actually maintain and improve your immune system. And there's been lots of research that's been published on that. And so I think one of the questions that comes in, if I do too much exercise, will that actually lead to compromise of my immune system? And so in the general population, you don't really see this very much at all. Where you typically see this compromise of immune function is in athletes that are doing a tremendous amount of exercise training per week. And sometimes you might have heard this, athletes have an overtraining state. They get into an overtrained state. No matter how much they train and if they eat well and everything else, they constantly feel tired, and they constantly getting injured. So that's really indicative of an overtrained state. But that really is very much on the extreme of the amount of exercise that somebody might do in a week. You know, individuals who are doing 12, 15 hours of exercise per week, and really at a very high intensity. So that's kind of on the extreme. Now in oncology, we don't know, if you think that's the upper threshold, we don't know in oncology if that threshold would have been lower. So maybe you don't need to do as much exercise to hit that threshold. So I know there is a concern about maybe during exercise and particularly undergoing cancer therapy that you might hit that threshold and get immune compromised a lot earlier. If you look at the data, including our own data here from Memorial Sloan Kettering, we found that exercise in cancer patients does improve many factors of the immune system, both during therapy as well as following the completion of therapy. We did another study in women with early stage breast cancer undergoing conventional chemotherapy. We looked at white blood cell count during the course of chemotherapy, and we found that the white blood cell count didn't change at all, and this was doing quite intense exercise training. So at least on the data that we have, there's no evidence to suggest that you do compromise immune function. But this is exercise training that is classically 3 to 5 days a week, about 30 to 45 minutes each time. There's kind of moderate intensity, which happens to be the guidelines for cancer survivors. Now, if you're doing much, much more than that, maybe triple that, there could be a potential risk of compromising immune function. Nobody's looked at that level of extreme exercise and measured immune function in cancer survivors. But I would really, I think, advise individuals to stay to the guidelines of the 3 to 5 days of exercise per week, between 30 to 60 minutes each time you do it at this kind of moderate intensity. And I think if you stay within those parameters, then I don't think compromising the immune system will be a concern. I think it's when you really go to the extremes outside of that.
Okay. The next question, and this is a common question that we have, particularly in people who have had a history of breast cancer or who are getting breast cancer treatment, is about soy foods and soy supplements and whether this is advised. And very similar to my answer to the last question about supplements, at this point we do have abundant evidence suggesting that whole soy foods, foods like tofu, edamame in practical portions, are quite beneficial and do not increase circulating estrogen in a way that was sometimes feared, and really don't have a downside in women who either have a history of breast cancer or are currently dealing with breast cancer or are at high risk. So again, the foods are certainly not a problem, and I would encourage including them in moderate portions as part of an overall healthful plant-based diet. The supplements I don't suggest, and there is a limited amount of research showing that in very concentrated forms, soy protein pills, soy isoflavone supplement pills, there can be a downside to using those concentrated forms of soy. So again, very similar to my answer to the last question, eat the food rather than taking the supplement pill.
Right. So now we switch gears a little bit to I think is just a great question, and this comes down to motivation. So very often when we talk about our research and we talk about the types of things that we're finding in our research program, the common question that we get is, well, Lee, that's great, but how do we actually get people to exercise? So we have a question here: is really any tips, motivational ideas to help really people incorporate exercise as part of their general lives? So, of course, it's not easy. We all have got very stressful lives, stressful jobs. It's very busy. We have families and everything else. So exercise is often the first thing to be neglected. It's the first thing to go because we see it as not a priority compared to these other things. And I think the only way really we're going to incorporate exercise into your lives is if you do make it a priority. So if you look at probably arguably the busiest man on the planet, the President, Obama, he does an hour of exercise every single day. So I think if he can fit into the schedule, hopefully the rest of us can as well. And I think it's finding those motivational and that tips for you that you can make it work. So maybe you're a morning person, so exercising first thing in the morning before you do anything else, maybe that's the first thing you do. You get up half an hour earlier and you make sure you do exercise the first thing. There's many of you who will be listening and say, well, I couldn't even dream about exercising first thing in the morning. So maybe that's at lunchtime. Maybe that's when you're at best, when you have the most energy. Maybe it's at night. And it's really finding those times throughout the day where you can really squeeze in exercise. And it's also the important thing of that is doing something that you enjoy.
whether it's with family, with friends, if you're walking your dog, of course, that constantly need exercising, of course, they're the best piece of exercise equipment you could ever buy. So I think, doing something fun, so when it gets back to those questions earlier of what's the best type of exercise, my response is always the same, and it's one that you'll do. So whether that's biking, swimming, resistance training, walking, something that you can really fit into your lives. But I think it really helps if you've got somebody to do it with who will encourage you to exercise all the time and really making it a priority. You wouldn't go a day without eating or sleeping. So really, you have to think about exercise in the same way.
So this is a question about alcohol and cancer, and whether it is safe to drink alcohol, what are the effects of alcohol, and this is a very big question. In general, alcohol is linked with the development of certain types of tumors, certain types of cancer, excess alcohol intake in particular. So I recommend, for most people, if you drink, do so in strict moderation. There are cases that limiting alcohol even more or even avoiding alcohol altogether might be warranted. For example, during certain chemotherapies, it might be a better idea to avoid alcohol altogether. And again, this is a situation where I would speak directly with your physician, with your nutritionist about guidelines. In some settings, having a glass of wine every couple of weeks might be perfectly okay, and in other settings that might not be. So always do ask these questions of your specific, ask those questions to your provider.
So now I think it's important to echo the comments that Cara is making about talking to your physician about dietary and nutrition. The same thing goes with exercise. Before you start any exercise program, particularly if you're not currently exercising, it's very important that you talk to either your oncologist or your general practitioner before you start an exercise program to make sure that it's safe for you to do so. There's also now a number of training programs out there right now that you can get certified exercise physiologists to have a background in exercise and cancer. And so if you can seek those individuals out, these are the ones that can really help you start to think about incorporating exercise into your life as well as how to safely do that. And that's all informed by the research that not only that we're doing here, but that's also going on all over the world. So the final question here, and I think this was a good one, given that both Cara and here, that we're here, and it's a question about what about the potential interaction between exercise and diet? And obviously when we either talk about diet or we talk about exercise, the first question comes up if I'm talking about exercise, well, what about diet? And I think if you're talking about diet, the first question comes up, absolutely. What about exercise? And clearly these two things go hand in hand. But it's interesting because in our daily lives, of course, we think about exercise and diet as going hand in hand. In the research world, we think about them very separately, believe it or not. So in our research program here at MSK, we don't do any dietary research at all. And the major reason for that is because I actually have zero expertise in diet whatsoever. Cara is the expert, not myself. And when we're intervening on exercise, we certainly measure diet to make sure it hasn't changed across the course of our studies, but we certainly don't intervene on it. And believe it or not, and probably quite surprisingly, in the literature, if you look at the evidence of if somebody incorporates an exercise program and eats healthily, as defined by whatever the case might be, there's actually very, very little research that has been done looking at those specific types of questions. And I think it's a reality of exercise, people like myself and nutritionists not really coming together to work on these questions. And I think very much in the field of my field, which is exercise, we've been, I would say, 15 to 20 years behind the nutritionists and oncology. And so we've come to the party late, if you will. So there's still a lot of questions that we need to work out to look at the individual role benefits of exercise. And for me, if we really start to work out how exercise works, then we can think about rationally how we can combine that with nutritional interventions. So whether it's caloric restriction, whether it's a change in fat content or carbohydrate content or protein. But certainly when we're thinking about our studies in the future, I think it makes sense that we'll start to bring the two fields together, because ultimately that's the kind of recommendations we want to make. We want to talk about exercise and diet at the same time because we know that's really information that individuals are looking for. So right now we don't have too much information, With exercise, again, I think I would just reiterate at this time that there are the guidelines out there. These are national guidelines that recommend about 150 minutes of exercise per week. And along with that, it's really to follow the American Diet Association guidelines is what we recommend as part of our program. But again, how those guidelines and recommendations might change based upon what we do, we're not quite there yet, but we hope to get there in the future.
Yeah, and I would echo that as different as those two areas are in the current research, it's hard to talk about one without talking about the other. And I can't talk with someone about diet without talking in some way about physical activity, and I'm sure vice versa. So in terms of our actual recommendations and practically speaking, day to day, what do we encourage people to do? I think that's all part of a very big and important conversation, and it's all connected, of course.
Yes, absolutely.
So I think at this point we are we're close to finishing, right? I think we're out of time.
I believe so, unfortunately.
So yeah. But again, thank you all so much for being here this evening. We hope that you will go back and look at the presentations and the Q&A. Again, these will be available online for you as a resource. Good night.
Thank you very much. Good night.
This concludes today's program on lifestyle and cancer. I want to thank you again for participating, and many thanks to Dr. Jones and Ms. Anselmo and Memorial Sloan Kettering Cancer Center for making this web chat possible. This program will be available on our on-demand section here on Cancer Connect so that you can visit it again or share it with others who may be of interest. Thank you.